Frequently asked questions about gummy bears and round silicone implants. So something's very common that I get patients come into the consult room and they say, "Doctor, I want a gummy bear implant." And when they say they want a gummy bear implant, they're just referring to silicone in general. So let's kind of talk about what a gummy bear is and isn't. So these are both silicone gel implants. This is a round smooth implant. This is an anatomic or a gummy bear. So when patients come into the consult, they're a little confused and they're just calling these collectively umbrella term gummy, but there are differences. So this is silicone gel, this is gummy again. What's the difference? The gummy really refers to the type of gel that's inside this implant. The gel inside this implant is going to be thicker. We call it more cohesive or highly cohesive. The gel in this implant is still cohesive. So either way, if you cut this down the middle or we cut this down the middle, neither's going to spill. This has to be more cohesive because it has to be form stable, which means that whether a patient's standing upright, flat, on the side, the shape cannot change. That's why the gel is thicker, to not allow the implant to change shape when the patient's in different positions. So another commonly asked question is, well, what are the differences? Do I want to go with the gummy bear or anatomic implant? Well, a lot of patients like the way it looks. So when I show patients on the Vector 3D imaging how they look, they're like, wow, this looks great, I really like it, it's a supernatural upper slope. There are two issues with it though. Issue number one, this could happen. So how would you look if that happened? Not good. It's called malrotation. Malrotation happens about 2% of the time. That means that the implant flips. So that's number one thing that patients aren't too excited about. The second thing patients should know is that it's a textured implant. Texturing refers to the surface. So this has a very smooth surface. That's why it's called a round smooth implant. This has a textured surface. It's kind of like sandpaper where it's rough. That texturing process allows the implant to stick down to the chest so that it doesn't rotate. So that's the reason they texture it. The problem with the texturing process is that it's been associated with a cancer. It's called anaplastic large cell lymphoma, ALCL. Every patient who comes in for a consult should know what ALCL is. It's a rare non-Hodgkin's lymphoma, super rare. What are the chances? About 1 in 50,000, 1 in 30,000 in some different texts. But the point is that there is this association, so patients should be aware of it. And usually when I tell patients, hey, this thing could flip and there's this weird cancer association, they generally tend to say, you know what, I like the way it looks, but I don't want it. And they end up going with a smooth round implant.